Hi friends, this is Dr. Abdequaem Chimthanawala. Today I will share a case of urinary complaints where symptoms were so precisely told by the patient and the remedy which came out also was very common to me, and it should have matched the symptom, but it did not work. And then on inquiring more about the case, I prescribed a very important drug that that is given in a maternal medica, but we don't use it so frequently. This patient came with the symptoms of urinary complaints. The patient had a constant desire to urinate. He used to tell, डॉक्टर साहब मुझे ऐसी इच्छा होती है कि बार बार यूरिन जाने का, कंटिन्यूस यूरिन जाने का, यूरिन जाते रहने का इच्छा होती है, a constant desire to urinate. So when I asked, have you any problem of prostate? He said no. Any problem of diabetes mellitus? No. Problem of diabetes insipidus? No. But he had the symptom of constant desire to urinate. Then I asked him, is there any specific time where you have to go, in the morning more, on the evening more, in the night you have to wake up? He said, no sir, every time, now also I have desire to urinate. There's a constant urging to urinate. Then I asked him, how is the urine like? So he said, sir, urine, with this desire, the urine contains a lot of sediments with lot of mucus. Now this is a very important symptom where the urine is contains sediments also, and it is mucus also. A very important symptom the patient was telling us. So I asked him, how is the quantity of mucus? What is the quantity of sediment? He said, sir, the quantity of sediments is profuse. ऐसी बहुत सारे sediments urine में दिखते जाते हुए. And he added that sometimes the urine is bloody also. So I thought maybe the patient was suffering from renal calculus. So we examined that part also, but there was no calculus. But the symptom persisted. Urging to urinate, urine had with sediments and mucus. The sediments were also profuse, and sometimes the urine was bloody. So we did a routine examination of urine to understand is there any infection or not. And in that examination it came the specific gravity of urine was more. The specific gravity of urine was more. So with all this symptom, he was prescribed drug, maybe my assistant prescribed the drug, routine drugs, but it failed. And when this patient came to me, this was a very important symptom where the specific gravity of the urine was increased. Urine had a lot of sediments and mucus and sometimes bloody. All the reports except the specific gravity was high. Then I asked him, any other symptom you want to share? He shared few symptoms mentally, but those were all common symptoms that were covered before also in case taking, except one symptom, and that was the identifying feature of that patient and the identifying feature of that remedy. The patient told me that he feels heaviness in the head. Now, if you tell heaviness in the head, you will say this is not a symptom. There are a lot many remedies where there is heaviness in the head. And I told him to describe the heaviness. And the patient beautifully narrated, okay, sir, I feel as if there is a lump in my head. Lump. कुछ सर में अटका हुआ है, lump समान लगता है. Now we have read in a maternal medical, lump feeling in the throat, lump in the abdomen, but it is a very rare symptom, a rare occasion where the patient tells you there is a lump feeling in the head. And if you repetize this symptom, one rare drug that comes out from this. But then we have to get the totality right. So when this symptom written on the paper, like constant desire to urinate, urine contains sediments, it contains mucus, sometimes it is bloody, sediments are profuse, specific gravity increased, and a sensation of lump because of that causing heaviness in the head. And my friend, there is only one drug in the maternal medic, and that is Urea. Urea Pura. Carbamide. The drug's name is Urea Pura, Urea Pura. I prescribed this drug Urea Pura 2 doses in the same day and called him after the month with the urine report. Because pathologically I had to see whether that symptom of specific gravity is reduced with this drug. And the patient came with the report repeated from the same lab, and it was the specific gravity came to normal. It was normal, and the whole symptoms of urging and sediments and the mucus were absolutely cured with 2 doses of Urea Pura 200. And from that day I learned more about Urea Pura. I want to add only one symptom which you must think when you have this condition, that is uremic coma. Whenever a patient is suffering from uremic coma, you must think of this drug, and that is Urea Pura. So my friends, go home and read this drug, and if you get a patient and you get good results with this, do come and share with me. If you like this video, please do share and subscribe. Thank you.